My area of expertise is fungal infections in children, and my research focuses on the unique clinical aspects we see in children suffering from fungal infections compared to adult patients. My main interest is in children born with inborn errors of their immune function, and one group is called by chronic granulomatous disease. Those patients have an increased risk of life-threatening infections caused by Aspergillus, a fungus which is commonly found in our environment. The research in our lab has shown that the outcome of Aspergillus infections in patients with chronic granulomatous disease is mainly determined by the excessive inflammation mounted by Aspergillus. And currently we are designing new treatment strategies to improve the outcome of invasive Aspergillus infections in chronic granulomatous disease. I've taken a comparable approach to look at Aspergillus infections in patients with cystic fibrosis. Cystic fibrosis is mainly characterized by a chronic lung disease, and those patients have the sticky mucus in their lungs. Half of the patients with cystic fibrosis will be infected by Aspergillus, and it's not clear why that is. One of the reasons is that it might be that the Aspergillus we inhale on a daily basis is just trapped in the sticky mucus. Another explanation we are currently researching is that the immune cells of CF patients are not having a normal antifungal response to the Aspergillus in the lungs. So far, our data show that the immune cells of CF patients are indeed responding abnormal to Aspergillus, and that again an increased inflammation is seen, which might be contributing to the progressive lung disease we observe in CF cystic fibrosis patients. My research is ultimately aimed at improving the detection of Aspergillus infections and improving the management of Aspergillus infections in those particular patient groups. And the research which we are doing at the moment to obtain an improved insight in what is going wrong between the fungus and the immune system will help us to design new treatment strategies in the future.